Hello and welcome to Fibroman. Well, since I joined the club, the Fibro Club, of all those who have fibro, well, in fact, I also joined some groups. You might have these people that I like, pun. Now, the thing is, you see, when I joined these groups, I thought I could get a bit of helpful advice. I'm talking about Facebook groups, okay? And there's one on here, there's lots of them actually, but a lot of them are very female orientated because women suffer with fibromyalgia more than men, so that's understandable really, isn't it? But there's one I've just joined and which says that men get fibromyalgia. And I just thought I was going to get sort of maybe take different posts, because I found that a lot of the posts were on the I can't remember what it's called now, on the group. It was just a fibromyalgia group. That's open to everybody, but it was because obviously more women have got it. You had a lot more women on there, and women suffer differently. I feel they do. In fact, they suffer quite a bit worse in many cases than men. But it was very much a case of you got loads of posts on there, and I asked people, like, do you get this or do you get that? And it's like they're very repetitive, and I got bored. I'll be honest with you, so I joined us. Men get fibromyalgia. And the first post I come across is this one. It says, I hadn't heard of this symptom before. Does any guy on here have issues with peeing? Sorry. I haven't, okay? I can pee quite happily. I've got the flow, man, yes, but don't cross the streams, no. The force of the stream, feeling like it's not strong. Dribbling, feeling as if you have to wait until the stream starts. He says, I'm 63 and he knows that he possibly got an enlarged prostate, as he has had some issues with it for some years, but wonder if meds can be attributing to the issue, to the problem. So I look at some of the replies and it says, yes. I thought, oh, well, crikey, I ain't got this to look forward to, have I? Have a weak stream. Oh, crikey. I had that for a while, and it was made considerably worse when I was on Cymbalta, which is one of the treatments you can use. I don't know much about that treatment, to be fair. I haven't looked into it. And whatever the other version of it is called, it might be maybe it's something like duloxetine or something. It was unbearable and frightening. Settled down once I weaned off the medication. Could be the fibro, but check your medication side effects. Well, okay, I suppose that's sensible. Yeah, I've had similar issues there, because another one. It started with losing the ability to feel the urine flow as it comes out. I can feel it. And the force went down to a dribble. The only thing still working normally is the sense of urgency. It's probably still got a full bladder. And somebody else says, I was like that. Then always felt like peeing, but nothing would come out, and it got very painful because you got full bladder. So it seems, somebody else wrote it, I don't know if this is actually a thing, where somebody actually just wrote Flomax. What's that? I don't know. But age could also be an issue with this apparently as well. But I haven't got any of this kind of issues with my medication. When I first saw that, I thought, my God, is he taking the mick here? But no, it's been deadly serious, because I haven't heard of this one before. The usual symptoms like brain fog and headaches and muscle pain, and potentially joint pain, that as well, tingling and all sorts of, basically all your body, really. But he's saying specifically to Cymbalta, which is a medication. I'm not sure what it actually is. I'll tell you what, while I'm actually talking to you, should I go have a quick scan? Because I haven't actually looked at this stuff yet. I won't be surprised it's a antidepressant, maybe. Is it an antidepressant? No, that's not how you spell it. Balta, that's it, I think. Cymbalta. Oh, it's duloxetine. It's the same stuff I'm on. I didn't realise that. And no, duloxetine does not make me struggle to go to the toilet. No, my flow is fine, thank you very much. I just don't cross the streams. That's all I don't do. Don't cross the streams, no. So yes, that's obviously another SRNI. Maybe he's taking too much. Because I've seen some reports of people, or some people saying they take 2 tablets a day for nerve pain. I think that's a bit strong. You take 2 tablets a day for depression. So my doctor said to me is you only have a small dose, which is basically 1 tablet of 30 milligrams a day, and that's what I take. And I've found it actually helped me quite a bit, actually. It's reduced the amount of painkillers that I require, which obviously is a bonus. No one wants to take painkillers, do they? It's just, you don't know what those things are doing to you. And, so it hasn't caused me any issues. And I haven't heard of any issues with duloxetine in this form before, not at all. Anyway, if you might find some respite out of these groups on Facebook. I don't go into too much detail and what have you. I do find it interesting sometimes, especially when I'm doing this channel. But I'm very nervous about taking medical advice from somebody on Facebook, or people's opinions regarding medication, because I'm not sure they really know. Because the individuals, they can only give you their own experiences, really, can't they? Anyway, you tell me, does duloxetine cause you problems with your flow? Leave it in the comments down below. Oh, God's sake, can't believe I made a video about that. Doodaloo.